Welcome to Black Health Matters. I'm Daryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callender.
We started this group in about 1975 and have been doing it ever since. We stopped for about 2 weeks after the pandemic started. And then the entrepreneurs in the group decided that they knew how to put us in Zoom. So we've been Zooming it ever since. Dr. Canterbury has a book that she'll tell you about. And that book talks about her life story. And she has a fascinating life story that I'll let her tell you about. But I've known her, and at least I'll just say that I've known her for, wow, I guess I can't say that either. It's been that long. Because I remember when I first met her.
It's got to be 30 years. It's got to be 30 years, at least 30 years, close to 30.
Actually, 1986.
Oh, praise God.
Yeah, 1986. Yeah, because she was working with Dr. Starzl then.
Oh my goodness, do I know him?
Yeah, and yeah, she was there when you went there, John and Carol. But I'll let her tell you about her fascinating life story because she's the first female African American transplant surgeon in the United States. And, that's quite a legendary status. And so without further ado, it's now, well, actually it's 1 minute to 9. But I will turn it over to Velma to tell you a lot about how she's gotten to where she is today. And tell them the title of your book again.
It's called Beyond Every Wall, becoming the first African-American Black female transplant surgeon. So those were the walls, really the cover of the book, which I don't have with me. It's really about my first obstacle, which was as a young teenage, preteen, growing up in Barbados and overcoming a group of kids who were bullying me on my way to school. And I had to walk past the cemetery wall. So the book describes my feelings, my encounters in trying to, as in the Caribbean, we talk about the duppies would come forth and perhaps guide me past these these young folks who would spin me around and bully me on my way to school. So that was my first encounter. As I wrote the book, my editor realized that each of my steps was another obstacle, and so it became Beyond Every Wall and overcoming obstacles from that standpoint. So from there, coming to Brooklyn and with my parents, my mom knew I wanted to be a doctor, and so we moved to Brooklyn. I went to high school there, and different system, different multiple choice, all those things I had to get used to, but she just thought I had no potential. And so her advice for me was to get a job and consider night school. My parents were absolutely not. You're going to college. And so I applied to a college down the street, living in Brooklyn, to LIU, got a full scholarship, went on to college, did well, made a dean's list, applied to medical school, applied to just 3 medical schools. Got into
Tell us a little bit about your experiences in Columbia. I think they're fascinating. Tell us a little bit about that. How they appreciated you when you.
At LIU, they actually, I got into medical school and I stormed into the dean's office and was so elated. I got Yale and Columbia. Where should I go? And they all looked at me with a shocked face, like, "How did you get into medical school?" Well, Jane over here didn't get in. And then someone blurted out, "Well, you probably were a token." So I said, "Well, I'll take the token and get me in." At the end of my 4 years, it wouldn't say graduating token doctor. It'll just say I'm a doctor of medicine.
Tell me something about the makeup of your LIU college classmates.
It was interesting because it was probably 40, 60. There was quite a few. It was right downtown Brooklyn. So they were, I probably say I probably didn't notice. I was more into my book work, but I remember having the encouragement of my anatomy teacher, Dr. Smith, and he was probably one of the few Black teachers that I had, and he was really an encouragement for me. I wanted to major in physics because I really liked that, and math, and I realized I could hardly pass the physics test. So it's like, okay. No, actually, I did better in physics than I did in biology. So I was thinking about maybe to get me into medical school. But yes, and so I tutored. I pretty much, I didn't live at school. I just went home every day, so I really didn't mingle too much with my classmates. I was so busy trying to get back and forth from that standpoint. So I might not have noticed. I know I had a few Black friends, and we sort of hung out together. I actually had one of my classmates was a young lady from Syria, and she had a heavy accent, and she wanted to go to medical school, but because of religious issues, she had to get married. And we still talk today because she vicariously lived through my career, and how I've done. And so from that standpoint, but I just saw it as as an avenue to get where I wanted to go to. And I say I really wasn't that involved in college that much at all.
Let me ask you another question. What made you so audacious as to think that this little Barbadian girl could go to college, number one, and then get into medical school? What gave you that boldness?
Well, I have to say, I probably got it from my mama. I was very, as they say, strong-headed, stubborn, determined. I was one of those kids who got in trouble all the time because if my mom said wash the dishes, I'll be like, well, I'll do it when I want to. Then you get slapped or something like that. But I was one of those, I never saw myself as not being in control. And for me growing up, I felt like I was born in the wrong age. This subservient, I was like, I'm never going to get married and be telling somebody, tell me what to do. That was my attitude. I wanted to be my own boss, and I wanted to have my own office. I was going to be in charge of people. That was my vision. I was just going to do what I wanted to do. And if you told me no, it made me even more determined to do that. So I was that stubborn kid who was like, you can't tell me that. I'm going to do it. And so that was maybe I was born with that stubbornness because my mother and I didn't get along because of that, because my dad would be like, oh, just let her be. She'll grow out of it. And so I ended up having a better relationship with my dad than my mom because my dad was like, oh, that's what you want to do. That's fine. But for us, education was key growing up in Barbados. It was always my siblings before me, the older three. I had an older sister who died in England. She went off to be a nurse. My other two brothers went off to England before Barbados became independent, because that's where you went. You went off to England to do their further training and for education. And then once Kennedy became president and opened the doors for people to then come here to the United States, my mom took that opportunity to move to Brooklyn because she knew from the time I was 8 or 10 when I wrote my first essay about my career, and I wanted to be a doctor. And so her goal was to make provisions for me to be able to become that doctor. And so
how did you all get to the United States? By boat or by
plane
or what?
Yeah, by plane.
Plane, yeah. All right, well, it's
but you still
interesting.
had to go for some reason. My mom flew. We all flew here, but somehow you ended up. When I go through the records for the first immigrants that signed into wherever that island, so my mother's name is in there, so I may be mistaken how she got here, but so I have to go back and check that because she actually signed in. I think it was whatever Ellis Island or where immigrants signed in, but certainly flew here. Yeah.
Tell me something about in LIU. What were the teachers who supported you and those who didn't support you?
I can honestly only remember that the one black physician who was my biology teacher, and he was a source of encouragement. He was the person who I went to, I was really shy and introverted. I just went to the library, did my work. I can honestly say I there weren't a lot of other folks who I was present, but I was there, but I wasn't present to them, and the encouragement wasn't there. I think I excelled uh, despite the lack of encouragement. One of the things that I always had a love of was photography, and so part of my journey was to also do something that I love to do. And so taking photography classes that was my relief, that was my stress relief, that was my environment. So I was, projects would lead me out. We would have projects all over the city to take these different type of pictures and present them, and actually was able to have my work featured in an outdoor art exhibit
All
at
right.
LIU when I applied to medical school. One of the things Columbia wanted to know was, how artistic are you? Did you play an instrument? Do you sing? Do you dance? They wanted to form this band. And I was like, nah, not me, don't play anything. I'm from Brooklyn, barely made it through high school. And, but I used my photography. And so one of the things I did was to write an essay in a competition for a grant that sort of aligned to the medicine and art and how it's similar in a way. And from that, and I got a pretty decent scholarship to medical school using my photography for a grant. So that was exciting.
Uh, in, uh, in college, uh, when you first learned that you got accepted into those schools that a number of your white classmates couldn't get into, how did you feel?
I had, for me, coming from Barbados and going to school, at that age, I wasn't totally aware. When you think about Barbados, it was more in a matter of what we call colorism. From the standpoint, if you were, I had this sense, and I talk about it a little bit in my book, that if you were of a lighter hue, if you're lighter than a brown paper bag, it seemed most kids got to go to a certain school. They had to shoe in. My dad claimed that it was more political. If you didn't belong to the Democratic Party or whatever it is, you didn't fit into that crew. But it's like, how come all these fair-skinned, half-white folks get to go to St. Michael's, and I'm going to this school all the way on the other side of the island? But I was sort of oblivious to that. So in college, I really wasn't aware. I would say I was ignorant of the fact that this social divide. I recognized in high school that I just thought that she didn't like me. I was brown skinned, I had an accent, I dressed funny, and my guidance counselors, who didn't think I had any potential, I just thought she just saw me as an immigrant. Here's this little black girl coming from another island. She, who does she think she is? And in my book, I described she would walk around with her ruler like a little wit, smacking us on her hands, and I just thought, this is America. You don't do those kind of things. But for me in college, it was that rejection was a real letdown in terms of saying, well, you're a token. But I felt that they didn't see me, and I still saw my potential. I still said, well, I'm going to do this. I got in, I'm going. And perhaps Jane didn't make it because she applied to medical and dental school at the same time. They could have gave her poor advice. Maybe that's why she didn't make it, But I just saw, well, I didn't think big. I was like, okay, I'm going to medical school. That was my goal. The door is open. I'm taking it.
That's very exciting to hear that story. It's always interesting. In LIU, did any of your white students treat you differently? Did they, because of your complexion, did they think that you were a different kind of human being?
We didn't mingle, not mingle. You hung out with your black friends. You go to the library with your black friends. Nobody invited you over for, we lived on the other side. They went in one direction. They went to Bay Ridge and the lower Ocean Avenue, and we went north to Fulton Street and back on back in the hood. So it wasn't like, let's get together. It was like, school's over, we're going our separate ways.
I see. Okay. Good. That's fascinating. LIU is a school in Brooklyn that has sent many people forward. Now going to Columbia. Now that's another story. Now tell us about your medical school class in Columbia. How many blacks were in your class?
There were 5 males and 5 females. There were 5 Hispanic women and 5 Hispanic males. They made sure that we all support them in case we wanted to link up. But that was it. And interestingly, those who were, Puerto Rican knew they were Hispanic and they identified with us and they hung with us. Those who were from South America didn't see themselves as a minority. They said, I'm not a minority in my country. Why should I be a minority? It gained them entrance to medical school, but they didn't see that. They saw themselves as white. So half of them didn't mingle with us. They went off on an associated. So really it was just the 10 blacks and maybe like 3 Hispanics that mingled, that all did the Black and Latino organization function. The rest didn't feel like they were in that class of minorities. So it was interesting. And so we definitely saw a difference in treatment in Columbia. It was a struggle to make sure that we made it through, as we saw with other classes, that the attrition rate wasn't the same. And so that was an issue. So we definitely had the Black and Latino organization that was the support for us.
How did your professors treat you in medical school?
We didn't get that, see me after class, let's go over this with you. That wasn't what, we had to fight for that extra time or understanding the things that we didn't understand. That was most difficult, that we certainly weren't treated the same. There were those who were failing and we had to make an effort to sit with them, go over the stuff, make sure they didn't fail. There was one Hispanic lady in particular. She wasn't very fluent in English, but she had a photographic memory. That was the thing. So when she translated or when she heard it and understood it, you didn't have to tell her again. So that was great for her because she was also pregnant during medical school, and that was a struggle for her. But we were there to support each other, but the system itself was not great until we got to probably 3rd year, and then had organized the Black and Latino organization to support the incoming classes.
4 years later, you finished. How did you feel as you were graduating from medical school?
I wanted to do surgery. That person that writes your letter with all your rotations, I did well on my general surgery rotations. I knew this is what I wanted to do. I met Dr. Barbara Barlow. She was a pediatric surgeon and I wanted to be just like her. I was going to come back to Harlem Hospital and take over that program. That was my goal. And I applied to surgery and my preceptor said, no, you should do dermatology,
Yeah.
or podiatry, or even pediatrician. Do you love kids? You will make a good pediatrician. And I said, no, I don't like kids. I'm the last of my family and I have no intentions of having kids. I want to be a surgeon. Well, I cannot write you a letter of recommendation to be a surgeon.
Wow.
He was that blatant. You can be anything else and I'll write you a raving letter. But
Wow.
this letter will not go out in your favor if you choose to do surgery.
Oh my goodness.
And I didn't have a plan B. That was my plan B. That was my plan C. So I said, well, I'm going to take my chances, not knowing there was no guidance. There wasn't anyone saying, oh, no, you shouldn't do that. Think about your. And so I applied to, like St. Luke's, all the neighboring hospitals. I don't even remember interviews. All I know was that on match day, no, before match day, I realized I got called to say I didn't match, and I had 2 or 3 days to.
Wow.
And so I didn't match into a program because he would say, that wasn't going to happen. I know what you were thinking. Well, I didn't know he had that much clout. I didn't know how the system worked. So I ended up hauling around. I had rotated at Harlem Hospital, general surgery, worked with Dr. Barlow. Harold Freeman was chief then, and I got a preliminary spot at Harlem Hospital to do general surgery. And that was in the pyramid system, but I ended up doing well and staying on and finishing general surgery at Harlem Hospital.
That's a fascinating story in terms of the lack of support that you got from Columbia.
Yeah, they didn't like that portion in my book, but yeah, they still invited me afterwards to give a talk. So I guess they realized, when I did realize later in life, as I told the story and before my book was finished, someone said, you should really reach out to him. He was a famous plastic surgeon at Columbia, Dr. Krizit. He was head of the plastic surgery department. But by the time I decided to reach out to him, he had passed away like a year before. I'm like, darn it, he wouldn't have remembered me from the cleaning lady anyway. So.
Yeah. Isn't it interesting that you wanted to work with Dr. Barlow and you wound up working with at Harlem Hospital with Dr. Barlow and Dr. Friedman?
You have to believe that rotating there was helpful. And being, as a 3rd year and a 4th year medical student. And Harlem at that time, I believe in divine intervention. That's where I was supposed to go. Maybe I didn't apply there. I was thinking too big. I don't know, but I ended up there anyway. And so for me, it was whether she was beyond my mentor, and maybe she was a sponsor that opened up that door. For that, I will always be eternally grateful, because she continued to open up doors for me. She continued to make paths because she knew that was my passion. When I rotated on surgery and transplant surgery at Columbia University, and we talked about the research that I needed to do, she says, talk to Mark Hardy. Mark Hardy, then I was able to take 6 months off to do research with Mark Hardy, who was a transplant surgeon at Columbia. And from there, I went on to an interview for pediatric surgery. And when I went out to Pittsburgh, an interview with Mark Rowe and Mark Ravitch, who was there at the time, he sat and he talked to me about everything else besides. He wanted to know where I came from, my background, my family, what my parents did, what my brothers did. And at the end, he says, you need 2 years of research to be competitive. You don't have enough research. And this is a very cutthroat business. There's only 12 spots in the whole country. What you need to do is to come back to Pittsburgh. I'm going to talk to Tom Starzl. You come back to Pittsburgh, do 2 years of research, become better qualified to be a pediatric surgeon.
Yeah.
And I talked to Tom. When I came back from my interview, Tom Starzl said, Mark already talked to me. No need for this interview. Let's go to lunch. And that's when I went to lunch with him and ended up buying him lunch because he had no money on him. Yeah. So I think the influences between Barbara Barlow, Mark Hardy, and Mark Ravitch got me to Pittsburgh. And then Tom just made it possible for me to be the first Black. There was one other Black gentleman that existed who he told me about. I don't know his name. He came through and started the fellowship. Lived but was killed in a car accident outside of Cleveland or something like that. I don't remember his name.
Yeah, I remember. Now you mentioned that you were thinking about pediatric surgery. What happened on the transplant rotation?
Well, 1986 to 1988 were the 2 years I was there, and we were supposed to do research. However, the fellows, we had 10 fellows in that year, and we were all clinically trained with licenses, and the people who we were supposed to be in the lab, but we had our medical degrees, we had a license to practice medicine. The people that stars had hired from China, Japan, and South America didn't have medical license to practice in Pennsylvania. And so we ended up having to take care of the patients, write the orders, do all the clinical work, and the people from other countries went into the lab. So I got to do no bench research at all. And at the end of my second year, it was like, okay, I was still interested in peds. I rotated on Dr. Ron Shapiro, and I love the pediatric vein and children's hospital. So that was my interest. Worked with Carlos, the pediatric surgeons. And I realized that at the end of my first year, going to my second year, that pediatric surgeons didn't do transplant. And now I really love pediatric transplantation. And if I go to pediatric surgery, that's not going to allow me to do transplants. So I should be better qualified as a general surgeon in transplant surgery and focus in pediatrics, which didn't have a separate qualification. So, and then, the whole point of doing 2 more years after transplant fellowship to do 2 more years in pediatric surgery is like, oh no, I'm tired of this. So I ended up staying on with a focus in pediatric surgery and working at Children's Hospital because none of the other fellows were interested in the pediatric side of things. So that became my loves. And so I was able to mingle pediatric surgery with transplant surgery.
Tell us about working with Tom Starzl.
Well, if you ever have the pleasure of reading my book, it begins, actually you can go on my website, beyondeverywall.com, and read the first chapter of my book. And it was my first appearance into and he started out by asking me, where the heck did you go to school? Did you do a correspondence course? And I was like, you must be kidding me. So he continued, which was his practice, to humiliate the fellows all through the surgery. And I was stuck in a corner under his arm, under the drapes by the anesthesiologist. So he really did torture me that first time. I was so humiliated. I thought, here I was a chief resident, and that was his style. That was the way he conducted himself, was to really crush you. And for those 2 years there, it was almost seemed like that's all we got was criticism and blame for everything that we did. When Clive came out to see me, I felt about this big. There's no way I can't be smart enough. I'm not good enough. I can't do anything right. There's no way I'll ever going to make it successful on my own. That's how Tom made us all feel, that we were stuck there in Pittsburgh and will never be any better. So that was quite interesting.
Did it ever get any better than that? I mean, was he always critical of you?
I tended to think that he was hard on me and all of us. Other people in the program thought that he favored me. So I usually say, if that was favoritism, I hate to see when you really dislike you. But I did have, he was also protective in the sense that if you took responsibility for your actions, and then you had to own up. And if something went wrong in a case, and I was the junior person or the fellow, and I'm getting the blame, he would stop and say, who was the attendant? Who was teaching you? Because you're only as good as the person who's teaching you. And he made the staff person take responsibility for whatever went on in the case. So he didn't let others dump on you in that perspective. And he had this memory to know exactly what suture you use. Well, if you hadn't used that 4-0 silk, this would not have been a problem. And so he really was he was making us better. And I think at the end of that first year, and I think he retired, he did his last transplant, I think somewhere towards when I was a second year fellow. But I think it made us all better. It made us be able, one of the things he was always says, don't focus, when you write your papers, it's not all about your successes. You still have to tell the bad things that happen, and you have to own up to the bad things that happen, because that's how you learn from your mistakes. If everybody always see the glory, they think that you could do no wrong. And this world, this training, this arena of transplant is always going to have not so good outcomes. And we need to learn from those not so good outcomes.
As you were coming up as in the field of transplantation, did you encounter any other females at Pittsburgh?
Yes, we actually had 3 females in our year of 10 of us. One was Jewish. I think maybe 2 were Jewish, but I know one was, one in particular was Jewish, and she had the protection of Leonard McCulca, and he protected her because he was also Jewish. The other young lady was very boisterous, demanding, and felt that she knew everything. If I said, let's give 2 milligrams of Lasix to this kid, she would say, well, no, it needs to be 2.25. And by the end of the 3rd month, I think folks were a little irritated by her presence, and she got shifted to work with the guy in Texas. Dr. Starzer sent her down to Texas for 3 months, out of sight, out of mind. And then after she came back, she sort of quit the program. She just didn't fit in. So it became just the 2 of us for those 2 years, basically. And yes, it was certainly, for me, it was, Pittsburgh was like being out in Utah or someplace, because it was certainly Midwest. It was very rural in the sense that the mindset of the people, so oftentimes patients would say, I never met a Black person before, or is more a Black doctor. And it was very difficult to be seen as the physician, or I was always somebody else. And that barrier of acceptance of that, yes, that my surgeon should be a white male, was hard to overcome. And so many times at the end of my case, or see a patient in clinic, and they would say things like, I have never met my surgeon. Hey, ma'am, haven't I been with you like from the first day you came in here? Who do you think I am? Just here to change your dresses every day? Yeah, so those with that acceptance, just like folks today can't deal with the word racism and that it exists. It's just like, if I don't see you and I admit that, then I don't have to admit that you were my doctor. And I'm still waiting for that white, glorious white man to come in the door. So, and the worst part about it for me was, we flew to different areas of the country to get donors, and going in the South, and my team, and being a leader of a team, and my procurement person was always a white man, tall. He went with me all the time. And then you have a flock of visitors, someone from South America, China. You have this mixture of other people coming to help you retrieve the liver and the kidneys. And no matter whether it was North Carolina, South Carolina, Georgia, I hated. Basically, you walk into a room in the OR, and the cardiac surgeon are automatically went to the white male. Hi, Dr. Scantlebury. And he'd be like, no, I'm not Dr. Scantlebury. This is Dr. Scantlebury. And they'll go, oh. Sometimes that's the end of it, and they turn away. And others, they have this indignant voice, and they proceeded to belittle my position about what we were going to do, as opposed to having a conversation, telling me what he's going to do and what he expects for me to go along with. So those were some really difficult times.
Tell them about those flights. Sometimes people think those flights are romantic. Tell them about those flights you had to take to all these different places to get organs and tissues.
Yeah, we pretty much used the Lear jets that took us out of Pittsburgh to wherever. Oftentimes we had to refuel in the middle of, if we were going beyond. If we're going to California, we'll have to refuel in Kansas City, and then go on down south. And I think, generally it was, you sort of was happy if the weather was good, but if it was rainy or snowy, you pray to God that you didn't crash and burn and get killed in doing it. It was very frightful. If you had a fear of flying, it was not something that you did easily, but you had to do it. And for me, the anticipation was always about how I would be treated on the other side. And I realized that as a white person, they never think about that because they have that white privilege of being accepted. But for being a person of color and being a woman, it was always troubling to say, okay, take a deep breath, make sure I have on this, air of authority, get set. It's almost like you're going into an act and, put that smile on so that you begin to get that respect the minute you walk in, and even just from the entrance of the hospital. But my protection and my getting accepted seemed to be okay because I had Paul as a white male with me. I think if all of us were just foreigners and he wasn't there, it would be like, stop, where do you think you're going? And who are you? And what's your name? And let's call security. So it was always that stop. Oh, okay, you're from, oh, I see you. So it was okay, as long as I was with him, then you could proceed. And that was one thing I remarked, and it was like, here we go again, but that's how the world was.
Well, it's interesting as a pioneer for you. As you look back, how do you prepare people, people look like you and are like you for going to fields like transplantation?
Well, you have to, and I think for Black women, it's not just transplantation. I think it's just the blindness of our colleagues to accepting us as being intelligent, being capable, being on their level, even being above them. And that's in any field. I mean, I think that when you look at the mentality of surgeons, there's probably a little bit more of the elitist group. And even if you look within our own transplant society right now, where it's difficult to even say, we're going to put a Black person on this board or this committee, it takes this second thought for them to say, what are you recommending? So I think even today, that acceptance is difficult. And that's why we can't talk easily about racism or the fact that there's bias, because folks don't want to own it. They don't want to own that in their mind. I see you differently. Why is it? And that still occurs. I mean, I talk to the fellows and the newer, younger generation, and the more things change, the more things remain the same. To a different level, as I said, we now have names for it, implicit bias and microaggressions, when they were just plain racist back then. We tried to soften the blow. The same residents why should a fellow be told, as one of the young attendants presented, and she said, yeah, and she is in, where is she? Where is Bud Shaw was, I forgot, University of Nebraska. And she says, she goes into the building now in isolation on a Sunday. And she walks into her medical to go to her office when nobody else is around, and she still gets stopped. Who are you? And why are you doing here? This is 2021. So again, the norms need to be, the mindsets, the stereotype, the bias has to be, people need to think differently. You know how irritating it is when you get into an elevator and you get in and they move their pocketbook to the other side. Like that's a
Yeah.
innate response, not because they're conditioned that you're a threat. And inside of your mind, you goes, here we go again, just because of your color. And so we talk about it, and one of the things I talk about and with the residents also in my book is about, after a while, I got into such a depression because I was tired of constantly proving myself, not being accepted, constantly the rejection in a place where I have no one to turn to. And I really, in a sense, um, when Meghan Markle was talking about her depression and how she went to the firm to seek help, and they tell you basically, we don't deal with that here. There's nobody here for you to. I felt like when I was in Pittsburgh, and in that midst of constantly, there were no other black doctors. There were no other surgeons. I'm trying to think, who were there? Other than the nurses, those were my outlet, and the people from South America who sort of related to me. So in terms of my circle, it was like, you got to go back to church, girl. You got to get grounded. You're being away from God. You've been busy. Go back to church. Find some sisters. Find some people who can support you. Link up with your sororities so that you're not constantly in this isolation, because it can drive you crazy and it can drive you batty. And that's why it's so important to have a support system. And in Pittsburgh, from New York, my parents were, they were struggling, trying to make it. And my brothers, they all had their own families. Everyone was busy. And my husband's family was from North Carolina. So we were like in the middle of nowhere. And it takes a village. I wanted to say, where is my village? I needed that village to help support, because it seems like the job was really affecting my mind, because it was the constant negativity from the patients, from my colleagues, and not having that support system was difficult to deal with. And I remember one of my Hispanic colleagues, he was at operating one day. He was just talking in general about how this whole place is a pit hole. And you feel sometimes that you can't make it up to the top of to the surface. And he says, I make sure I wake up every morning, I take my Prozac, because I know my Prozac's working when I don't give a damn. And I was like, you take Prozac? And he said, yeah, I wouldn't be able to make it through if I didn't take my Prozac. And it made me realize that I wasn't alone in this hole that we all felt we were in together. And that made it okay for me to go to my doctor and say, I need some help. I can't do this alone. And no matter how they say, folks would say, well, just pick yourself up and just keep going. I realized I needed something else, because that mentality around was not going to do it. Just by myself. So I remember taking St. John's wort first, because everyone said, oh, it'll make you feel better. I think it made me stupider.
Yeah.
As far as Gump would say, until I got onto Celexa. And for years, I still told myself it was for hot flashes. It made me feel better, telling people, oh yeah, I take it because I have anxiety or something. But yeah, mental illness is one of those things that people don't talk about. And it's great to even discuss, because our situations sometimes, you have the situational, but if you don't change your situation, sometimes you then dig yourself deeper into that hole.
It's amazing to think of the isolation that you were exposed to. Wow. And only you could tell it, because as you look back, what gave you that inner strength to deal with that isolation that you had for so many decades?
Well, I have to say that once I got grounded again in God and turning to Him in prayer, and my family, my parents are always a big support. My family, even by phone, was a big support. And then I developed a community. I remember this lady who I didn't know. I started, talking and giving talks. And one Saturday, she drove up into my driveway. And she said, you're Dr. Scanderberry, right? She says, yeah, I know. I said, yeah. She says, okay, I know you're here all by yourself. And I just want to come over and introduce myself and let you know that I'll come help you. And every Sunday, I'm going to come over right after church and give you a break. And you can take 4 or 5 hours. I'll watch the kids and just
Wow.
keep some time down. And that was so nice. It's like, we talked, we went to lunch, and then from there on that, she became that of the family for me. She became my daughter's grandmother, godmother. And unfortunately, within 3 years later, 2 years later, she was complaining about her stomach. And I was like, Gwen, you need to go to the doctor. She says, I know I have cancer, but I'm not going to the doctor. I know something wrong with me. And it turned out she did have pancreatic cancer. She died a year later. But that she was a godsend. Yeah, she really was. And there were people like that who were there to support and help uplift me that made a difference when my family couldn't be there.
Wow. Now tell us about your family, your husband and your 2 daughters.
Well, I met my husband on a blind date. One of my medical students, she was from Louisiana, and she was a third-year medical student, and she met Harvey, who was in Pittsburgh on a sabbatical at Pitt, and he was driving. He stopped at one of the stores on Forbes Avenue and ended up at a light or someplace right behind her. So she also had Louisiana tag. So he jumped out and knocked on the window and said, just introduced himself and says, "You're from Louisiana, I am too." And that's, they got to talking. And so then she called me up and she said, do you mind dating an older man? I'm like, how much older? And so I said, okay, he's on just about 4 or 5 years. I don't know exactly. I said, okay. And then she called him up and said, I found you a wife. And so she made a 3-way call. She goes, I'm gonna let you talk to her. So she made a 3-way call between the 2 of us, made us talk. And she says, I'm not hanging up until you guys decide to go out and see each other. And so we decided to go to lunch 2 days later, and the rest is history. Yeah, 6 months later, we were married.
Wow, amazing.
Yeah. You say always, ask God for I wanted to have an intelligent woman, who was strong and could stand on her own. He said, but I didn't ask God for this much strength.
How did you put together being a mother and a surgeon?
It was difficult. Initially it was, I have to say it was most difficult being pregnant, and I couldn't tolerate the operating room for liver transplant during my pregnancy. Somehow the stench of the old blood after 4 hours or so was really nauseating. And so that was how the return. So I ended up switching over to kidneys where I could be in and out faster. And it was okay with the first child, being a baby, you had a babysitter, it was tough coming back to work, that sort of thing. And so with the second child, I decided that I would not go back to livers until, there were maybe 2 or 3 and I had more time. But then they get to be 2 and 3 and you realize life gets busier, because then you have to think about taking them to school and dropping them off, and then they're constantly being sick. And so my desire to go back to livers kept being pushed off and pushed off. And so I ended up staying on kidney transplant because it was more predictable. I could set my schedule. I could take care of them. Most of if it wasn't a living donor case, it was planned during the day. If I was on call, the operating room was not available until 10 o'clock at night. So I could almost go home, do what I need to do, put the kids to bed, come back and work from 11 p.m. To 5 or 6 a.m., go home and get them up and out, and then come back to work. So that became most of my routine for a long time.
So in many ways, the life of a female transplant surgeon is, wow, it's pretty tough. You know, as a,
I felt guilty a lot, missing out on things that my kids needed to do. My kids always complained about they didn't get to do Girl Scouts to a certain level, or I missed this and I missed that. So, some days I feel like I could be Catholic with all the guilt that I bore each day.
at this point in time now, you've been a transplant surgeon for decades, and as you look into the people who are coming after you, how many African American female transplant surgeons are there now?
There were 12, but then if you, minus Charlene Gordon, who died, Rosemarie is no longer practicing. Two others were trained and do general surgery. One young lady, she goes to Nigeria to do her to help with the kidney transplants in Nigeria. And the other one, she does a little bit of call, but not full time. So in theory, there are probably 10 or 9 that are practicing. Well, now 8, because now I retired.
What do you think about this new life as a retired transplant surgeon? And as you look, what do you see your future based upon where you've come from and where you are now?
I'm really busy right now. I need to take some stuff off my plate. My calendar every day is full of stuff. I keep trying to say no to committees. Transplant actually just pulled me, ASTS, into another representation to something else. I love teaching and academics, so that's my purpose really, is to continue to drive the education and focus on disparities, racial inequities, and issues surrounding our Black and Brown communities when it comes to transplantation and when it comes to medicine in general. So one of my platforms right now is really talking about the racial inequities in surgery itself, within just medicine, but surgery. And also on education when it comes to Black and Brown. I do a significant amount of work with Black Doctors COVID Consortium in Philadelphia in terms of really helping them as a senior advisor to my mentee, Ayla Stanford. And that is her organization, driving, trying to eliminate those disparities, but also just focusing on what we can do as people of color when it comes to driving the needle for organ donation and transplantation and getting more work. And I hope to do more with MOTEC, hopefully. And I think we have a meeting coming up planned with you, Clive, to talk to Kirtiats to see where we can go with them, either offering a grant or hosting MOTEC.
As you look at where you've come from in terms of opening the door for African American females, is that a door you're glad you've opened, or what is your sentiment now?
I'm so encouraged by the amount of medical students and residents who are interested in doing transplantation and seeing it as a possibility and learning more about it. One of the things I didn't have was that guidance and that knowledge and foresight. So the 8 of us are, and now we've tried to pull in 9 of us now, from including 2 surgeons from Florida, which we didn't know. I think I talked about one in my book, but we try to have monthly meetings along with the fellows, along with the medical students who are interested, to talk about issues that exist, the things we experience, how to deal with issues, realizing that you're not alone in this struggle. And like I said, the more things change, the more things are still the same for this younger generation, dealing with being treated unequally and not being promoted and not being paid, having that parity in pay. But now you have an avenue to deal with it. Now you can be more vocal, you can speak up, and you can demand things. And unfortunately, or as I tell the medical students, at certain levels, you can only do so much, but you also don't want to be um, taken advantage of, knowing in terms of what to expect. And programs, more and more general surgery programs, surgery programs are identifying that there are these disparities, and females and Black females are treated differently. Some of them care enough to want to do something about it, and others don't. Unfortunately, we have a young surgeon who actually was trained at Harlem Hospital. I met her at some of the meetings years ago, who went off and in her fellowship with between sexual harassment and racism and issues that she faced, she has disappeared and we can't find her. And that's very disheartening because we know she didn't have that support and was kicked to the ground. So I'm at the point where I'm ready to hire a private detective to figure out, is she dead? Where does she go? No one needs to be out there alone by themselves dealing with these issues. And that's why we need a support system. And that's the importance of what we continue to do as a group. We're here to support others, encourage others, and build that platform to know that when there's difficulty, at least you have somebody to turn to.
Well, we've heard an interesting inside story of something that none of us really could feel before. I think you get a feel for what Velma went through. And it's painful to even hear the story, not to speak of the sense of loneliness and despair and hopelessness that a normal person would feel after going through all of that. But I'm going to open the floor up now for any questions you may want to ask Dr. Scantlebury, as she's told us so insightfully about her journey.
I just want to applaud Dr. Scatterberry for her commitment and drive. Her story was about a lot of obstacles, but it didn't stop her. She moved forward, and she mentioned several times the word support, which is appropriate. That's what this group is about, support. And sometimes you do hit that roadblock where you're just devastated. But when you have that support group behind you to encourage you, it means a lot and you can move forward. I appreciate her talking about her medical achievements in her career. It was very insightful.
Thank you. Thank you.
Dr. Scantlebury, I'd just like to say hello. Hello to you. And thank you so much for all of your contributions, not only directly in the hospital and with transplantation, but also in the community as you go around the country, around the world, spreading the word about transplantation, especially in Black and Brown communities. I know that loneliness is hard, and especially as you go up the ladder and there are fewer and fewer of us, it gets harder and harder. And I think that you're acknowledging the difficulty and having the courage to reach out for help is a real testament to your strength of character and your strength of purpose as well. And I think it's a great example and makes you an even stronger role model for those that follow you and for the rest of us as well. I wonder if you have any particular advice for those of us who are trying to encourage more people, more brown and black and brown people, especially in a hospital situation where a person is at the end of life and we're approaching people to try and donate an organ. Do you have any suggestions, any advice in terms of the best approach for that? We're losing a lot of people and a lot of potential organs, and I would love to either talk, not maybe there's not an answer now, but I'd love to discuss that with you further.
There's some no, you know, it's still, you know, it's difficult as far as organ donation in our community, and we continue to really push it. But having an understanding of the process, the benefits, the earlier they get that information, the more knowledge that they have. It's hard to get folks to think about donation. It's not on their radar. And so we all have this thought, man, you know, maybe we're gonna live forever. Some of us are late even thinking about a will because we don't want to deal with death or that we're gonna pass on. And so that becomes something, the more we have that early education, we focus on family gatherings, you know, family reunions, picnics, Christmas, Thanksgiving, every time there's a holiday. I remember it was Secretary Thompson way back years ago who had come up with these flyers to have family discussions, to talk about organ donations around the table. I think that was one of the first ones. That whenever you gather, what are you going to do with yourself at the end? You know, how can we benefit? And one of the things that drives home in the groups that I talk to is I always start off with talking about, now who's diabetic and who has high blood pressure? And he goes, you know, you may be silently losing your kidney function. And just imagine if 10 years from now you need a kidney, what that would be like out somebody you know, because in our disease process, we don't think about what's down the line. And so I think we need to talk a little bit more about that early education of how do you have that in your foresight? What are you going to do with them anyway? And so if you have that discussion early, then it's much easier to accept it during that time. And your family is much more likely to consider it. So those are just my thoughts. And certainly I don't have all the answers.
Those are big ones. Thank you. Thank you so much. And affirming.
Doctor, my name is Maya Thorpe, and I'm a chaplain. I want to congratulate you as a physician, as everything, really, pastors and everybody. Nobody has touched up to this day what you touched on, the question of racism and how it affects you mentally, isolation, everything else. And I'm so happy you brought that up about it can drive you, mentally. And I have seen patients that have become schizophrenics, and they wonder why young Black kids are committing suicide and all that. And you hear a lot of this in the schools and all that. Those who go to predominantly white schools and everywhere in the workplace. And you're the first physician that I heard say this, and it happened in my family. One of my family member became a schizophrenic as a result of that racism. He was only 14 years old at that time, and they used to call him a monkey swinging from tree to tree and all that kind of stuff, the white people, because he was a champion in sports and all that. So I am really amazed at what you've gone through, and your spirituality has held you up, and you're very honest. You brought up what whole America needs to hear. They need to know what the racism is destroying the people, brown and Black people. Thank you very much for your honesty and bringing this up in the public.
Oh, definitely. I think, it's just one of the things for me I had this vision of when I was in medical school and even as a young resident, envisioned where I would be in life and how great and wonderful it was going to be a Black surgeon and accomplished, being able to be my own boss, do these things, just sort of fight and help people all the way. And then I got to where I was in my last 5 years and realized that after 30 plus years of struggling constantly to prove myself, to defend who I am, to really still, I think it was just last year, earlier that year when I went into, you go into an operating room and still after 10 years in the same place, and someone continues to constantly ask you, do we need you to call Dr. Smith to help you? Oh, Jesus Christ, do I look like I need help? And you realize, I said, do you ask him if he needs my help? Are you constant? Well, he says, well, whenever he tends to call in and wants to know whether you need his help. No, I don't need his. Have I ever called somebody to help me? And so it's those things that just sort of go, yeah, I'm too old for this stuff. You know, it's like, I've done this. I constantly, you as a white nurse, me as a Black doctor, and yet still, I haven't had anyone die on the table. My patients wake up, they go out, they don't come back again and again to be operated on. Some people are now.
Yeah.
And you realize, God, I think there's something else out there for me to do. And for me to keep my sanity, because I'm losing brain power, I'm losing my mind. This stress is giving me ulcers. I'm getting scoped every 3 years, trying to decide whether I have Barrett's esophagitis or cancer. I've got to move to a different level because I will die early dealing with this frustration. And maybe I should have taken a job in a different place at a different time. But at some point I had to decide I've got to live in a better way, in a different state of mind. And I have to say, that's what drove me to retire. It was like, I can't take this stuff anymore. I'm done. I'm out of here. I've got a bigger purpose, and that's what I'm doing. So this is my bigger purpose, and he's going to lead me in a different path. And I know it's going to be better. So I thank you for listening to me.
The floor is open for any other questions that you may have for this legendary character who has done a service to all mankind, and the appreciation of the agony that she's had to go through.
So my forte now is my platform. I can talk about anything I want to talk. I can talk about race. I can talk about anybody because they don't give me a paycheck anymore.
Yeah.
I can definitely talk about racial issues, and that's my platform. From one graduation, whether it was Hofstra to Temple, to University of Texas, I blow my horn and I let them know that you've got to be honest and uncomfortable, and you've got to be willing to be uncomfortable if we're ever going to bridge this gap of the racial divide and the inequity. And we call it microaggressions. Oh, you speak so well for a Caribbean person. Do you really? Is English your first language? No, it's German. And so those things just drive you batty. Oh, you're pretty for a Black doctor.
Dr. Callender, I may have missed something, but I wanted to know about her first surgery, her first transplant surgery.
My first transplant surgery, I remember I walked into the room, and I think it was a kidney transplant, and Rob Gordon was on the back table. He was doing something. He goes, I had just come from Harlem Hospital. I hadn't rotated in that, but he says, oh, you're new. Okay, go ahead and start the case. And I was like, start the case? Okay. And I had another surgeon with me who was a trained surgeon from Taiwan. And so he like, okay, I remember. And so I made my incision. I'm going down trying to go, God, please guide me. I don't know what I'm doing here. So he helped me through, and he's like guiding me. He's my first assistant surgeon, but I'm actually a surgeon. He's showing me what to do. And then dissecting the vessels, and it all came back. He was the one doing most of the work, but making me look like I wasn't stupid. Until I got to the point where I realized, yeah, I know this stuff. No, the brain is working now. Here comes those memories back. And so I was able to, then the attendant came up and I put the kidney in, but I was scared as hell. I was like dropping beads were coming down my head, but patient lived, she did okay. But yeah, once I'm there, like, I got to get my act together. No walking in the door expecting people to show you stuff. You're a chief resident now, right? You can do this stuff. Yeah, I can do this stuff.
Thank you.
Dr. Scantlebury,
Oh,
yeah, I'd like to congratulate you, and I'm inspired by your story big time. I've been to Barbados once as a scuba diver. It's beautiful water there, and I plan to go back at some point. And to learn the history of that island is really amazing. And the other side is, I was in a lab at the NIH, as an assistant one summer, and I saw that the chief researcher in that lab gave a glowing support letter to one of the other assistants that was in that lab. But when it came, and of course she was white and the assistant was white, and when it came to me and another Black teacher who were assisting in that lab, they refused to even acknowledge our presence in the research. So I've seen that lack of support that we might expect from white doctors, white scientists, and the Black scientists and Black doctors now have to fill that gap in support. And that idea of us, the education across science, across research, I think it's really important. And thank you, Dr. Callender, for introducing us to Dr. Scantlebury. It's really awesome. I'm filled up right now. Thank you so much.
Thank you. Thank you.
Dr. Scotter, how are you doing?
Good.
I have two questions really. I also grew up in somewhat, my brother and I, in a white world. Well, we had that support group, like you said, the church and etc. Because especially when you go off to college and you have teachers and you're the only one sitting up there and they do these racism things, but you grow there. But you need that base to give you support in different scenarios. And even when I came to Washington, D.C., that I saw another racism among Blacks, what you call that brown paper bag. And if you come in a little bit too dark and etc., they put you off. You have to be at the top of your field. But noticing, and I also have children, how did you give them support by knowing the world? What type of world were your children raised in? Was it this Black world or the white world or the integrated? And how were they able to cope with the racism? Or what did you do?
And, initially, my kids went to a lab school, which was mostly white. It was near the hospital, so it was convenient. And I saw they were having trouble. My daughter had ADD, and they asked me, pretty much said she was learning by accident. Okay. So we pulled her out of there and went to a small Black-owned school that they just sort of individual learning according to the level. And we did that until I left Pittsburgh and went to Mobile, Alabama. And that was then thrown them back into the wolves where it was a white private school. And it was probably not the best thing to do, but we ended up getting there after the school year. And Alabama has some kind of lottery system. And so it was difficult to then find a school if you arrived after September. So we then had to find an opening in private school, and that's where they went. My daughter struggles still with ADD and, from behavior modification to different medications, and she also has seizures. So it was a sort of like specialty treatment. And I have to say that growing up in that world was probably negative in the sense that they being the only ones was hard for them to deal with. They were happy when I came back to Delaware and they went to public school, and then was integrated, but that was only for like 2 years. Um, so my daughter to this day, she goes, well, if you haven't brought us up in the white world, we wouldn't have all these issues now. I said, well, things it's now, they really felt like the world wasn't fair, and they had difficulty adjusting to some level, um, and even to the point where my daughters, each of them have they have different views. Um, One, on the other hand, was so anti-Black that she didn't even like the Black art in our house as a teenager growing up. And now she's into art and really have gone full pendulum in terms of being an activist, out there marching and demonstrating for the rights of Black and brown gay people. So she has gone a full pendulum that way. So I think they have to sort of learn, and they learn on their own. They learn by error and mistakes. And so she's in Washington, D.C. now. She worked for a Halcyon, an independent firm, who, after she also felt very stressed in the racism in that company, confronted them about the racism, the different treatment with the fellows, the white fellows versus the Black fellows, advocated for them. They didn't appreciate it, but when the new class that came in with COVID, they actually confronted the racism themselves, and in terms of management, she just thought that the administration-wise or the upper level was not going to change. So she said, I can do my own stuff and bring in grants for them. And so now she started her own business and decided that she wasn't going to deal with them. She just said, one day, I'm going to quit. This is just too much. They're not going to change. They're not going to promote me, despite all that I can bring to them. So I said, you're young, you can do it. Go out on your own. So that's what she's doing now. So they're surviving.
Okay, and then my last question, I'm a layperson because I'm not into the medical field. And I heard you mention a little bit what they offered you that you could be. And I was thinking, okay, what's on the bottom of the totem pole as far as being a medical doctor? What's on the highest? Is surgery the highest? Is podiatry the lowest, or what?
I think it was just a matter of them, surgery is an elitist field. Your typical white male. And as you get into the subspecialties, neurosurgery, what else? Transplant surgery, cardiac surgery, there are very few people of color. There's actually orthopedic surgery, but I just realized that there's a Black female orthopedic group that's Zoom, and they have over 90 plus members. So that's a growing field for Black women. And so when you think about for him, it was too challenging. When you, like for instance, many residents say these days, you're not supposed to ask them about being a wife or a mother, but they're worried about whether or not you're going to get pregnant. You're going to have to take time off. It's going to be hard on your male partners. You need to do something less complicated, like podiatry, where you don't have any emergency calls, so you're not on call all the time. Things that you can handle as a woman, basically. Because surgery is seen as a man's field. You got to be strong. You got to be able to stand up all night and da-di-da-di-da. Right.
What's the longest time you spent in surgery? Was it 17 hours, 18, or?
Yeah, about 16, 17.
And what did you do in between time? Because I read Dr. Stonsel's book, and he would play Pac-Man and stuff like that in between to take his break.
You take breaks. People will come relieve you. You take break. A team will come in and give you a break. Do a section while you go over and get something to eat and come back. Sometimes you're waiting for the organ to work, and so once you put it in, you may give it a break. Especially with the livers, you would leave the patient there with anesthesiologist. I know sometimes Dr. Stars will run us down to the street to go to get a hot dog and come back. And the patient will be still on the table. Can't do that these days. The regulation. Yeah. But you take breaks. Sometimes you have a different team come in and you come back, you go put your legs up and relieve the pain in your legs and come back and go again. But your adrenaline keeps you going, then you pass out afterwards. And you can often go from case to case. Oftentimes when I was younger, I would do 3 or 4 transplants in a row and think nothing of it. But then you hit 50 and all of a sudden your back hurts like hell.
Velma, one thing you didn't talk about, and I think you probably take it for granted, but actually Tom Stossel is probably the greatest surgeon of this century. As you think about working with him, what do you think about the fact that you worked with probably the greatest surgeon of the century?
It was truly an honor to work with him because even those who were great, Toto, Shenowski, that he brought from Denver with him, he just had a skill that was masterful. And his intensity and his concentration and being meticulous oftentimes will go out the window, but he would get the job done. I remember when there were kids who had biliary atresia and had 3 and 4 operations that made it difficult to get the liver out, and surgeons would be there struggling for hours, and he would just come in and put his hands in and around, he'll make a mess, but he got the job done. And we then can clean up after him and get the patient up and out. And so he taught so many of us the art and a different technique in terms of even from doing donor surgery, different ways in terms of operating, and everyone has a style and you sort of learn your style over him. But it was really a phenomenal experience to really scrub on a case with him. That's why there were always 10 people in the room whenever he was operating.
Dr. Scantlebury, do you have an opinion as to whether men or women surgeons are more meticulous?
Well, I have bias. Women, hands down, there's no competition there. And I tell you this, just a simple, for the last 12 years, I practiced with one surgeon, and I will tell you that when you put a kidney in, depending on say the left kidney, the vessels are shorter, so you often just put it in and you make your attachment. The right side, the vessels are somewhat longer, and to prevent kinking and making sure that the things are flowing, you may want to put it in, make sure I'm very particular about how I lay the kidney in down so that there's no kinking of the vessels onto the next where you make the connection, and you're not just pushing it down, then you make it pushes in and then it folds or something like that. So unbeknownst to me, as we were doing biopsies with the technicians, and we do our own kidney biopsies, the technician said, she was like, she would be scanning before we come into the room, and she would say things like, Dr. Scantlebury did this transplant. Was Dr. Scantlebury your surgeon? The patient would say, yes. Yeah. I knew it. And so when I said, why'd you ask that? She says, we know exactly whether you put the kidney in or your partner did. Just I know just by the way the kidney is laid in its position. So you're very meticulous about how you make your angles and how you want that kidney that vessel to lay. Well, the other person just sort of puts it in. So that was sort of going to so if I couldn't remember, patients years later, I'll be like, who did your kidney transplant? The technician will say, you did, I could tell. So that was just a going joke between the two of us.
That's a great confirmation. It's always been my experience that if I need something meticulously done, I'll give it to a woman.
There you go. Sorry, Clive.
No comment.
Dr. Scantlebury, my question to you is, well, first of all, let me commend you for your journey. You have truly had a very interesting, very studious um, all the parameters that it takes to get you to where you are now. My question to you is, how did you come about your decision to go the direction that you're going in now when you decided to retire? There's many people who will retire and they said, I am up to here with all of this that I had to go through. I'm going to get me a set of golf clubs. I'm going to go to the golf and I'm going to start taking up golfing. Or they may decide to travel. How did you make the decision to continue with your training in the way that you are now after you retired?
One of the things that I always enjoy was academic medicine. The downside of where I was at Christiana Care was that it wasn't an academic center. And I did not want to end my career not doing academics and not teaching. And I couldn't see that. It's like, God, this can't be the end of me. This is not how I wanted to end my career. I wanted to do something that I loved doing. And so in 2019, I applied, was working with Pecan here in Philadelphia, and the person I was working with went to University of Texas as the minority dean of minority affairs, inclusion and diversity, they call it now. And so she invited me to apply to University of North Texas to be a professor of surgery so I can help teach, but the new medical school. And so that was my focus. I wanted to be back in academics and I wanted to teach. COVID came and some of that got put on the background, but I still became a professor there and did a lot of lectures remotely for the medical school. And so for me, this is always what I wanted to do in terms of education, teaching, and outreach. And so this was the perfect avenue for me to go.
Thank you.
Well, thank you very much. If there are no more questions, we've taken up so much of Dr. Scantlebury's time, but she's done such a fabulous job of helping us understand her journey, unlike those of any other. So we thank you so much, Dr. Scantlebury, and look forward to others looking at your, reading your book. And I see Dr. Walton has a hand up.
Yes.
No, that's a hand clap.
Oh, that's what that is. Well,
But Dr.
yeah, we'll all
Scantlebury,
applaud.
I will be in touch with you very soon about something. Okay.
Thank you. Thank you guys so much. Appreciate it.
Thank you so much, Velma, for helping us out again.
All right. Take care.
All right. Talk to
Bye.
you. Awesome journey.
Yeah.
You're a great interviewer.
Mm-hmm.
Good job.
Mhm.
Yeah. Thank you. You're very kind.
We decided last week he was the icon.
I'm sorry?
I said we decided last week, I think by acclamation, that you're